Hello, I'm Dr. Prashant Dhanraj. I'm a consultant orthopedic surgeon at Kamineni Hospitals, LB Nagar. In my day-to-day OPDs, we see a lot of people presenting to us which they feel is a very simple problem like shoulder pains, wrist pain, knee pain, and they neglect it for a long period of time until it affects them, their daily activity and their daily routine. So few conditions like repeated shoulder dislocations or a pain in the knee, a popping sound. Sometimes they are unable to lift anything with their hand. They get pain at the wrist, which they neglect it for a quite good amount of time. So the treatment here would be a very simple. They need to first get evaluated what is the reason of pain. In major of the case, it may be just a muscular imbalance or a repeated form of activity which is causing a strain at the muscles or the joints. So few cases we may be evaluating in the form of ultrasound, few may require an MRI scan, and to diagnose whether there is a simple bony injury or there may be muscle imbalance or it's some form of swelling around the tendons of the wrist or the joint, ankle. We have diagnosed a lot amount of unstable shoulder where the ligament instability is at fault. We have treated them, we stabilized them initially by physiotherapy. If they're not receiving surgical corrections in form of knee pains, many people have meniscal injuries, anterior cruciate ligament injuries, which they neglect for a long time till they have repeated falls and repeated locking episodes at the knee. We get a simple MRI, found out the cause, repair the meniscus or reconstruct the ACL ligament, a few period of rehabilitation, then they get back to their normal form of life which they had incurred before the injury. Few cases like tenosynovitis where intralesional steroids can be given. In severe cases, a simple surgical release of the tendon sheath will improve the hand a lot. In case of ankle instability, because of ankle sprain, they may be suffering with chronic ankle pain. So ultrasound can diagnose the condition, and if required, they may require a surgical correction in the form of ligament reconstruction. But majority of the time, a simple plaster in the initial part of the injury and early rehabilitation can avoid these surgeries. So don't neglect the symptoms, and if they are causing or repeatedly hurting, better to evaluate it and treat it at the earliest to prevent it from getting complicated and get a surgical procedure. Thank you.